Hello, everybody. Dr. PK from DrPKLyfe. And today I am going to discuss low platelets. This is my first YouTube live, and I'm going to discuss low platelets, thrombocytopenia. I have this video on TikTok, and I wanted to do on live on YouTube. And the low platelet terms is called thrombocytopenia, and it's one of the most common, very common blood disorder after anemia. So, low platelets, what is the normal platelets number in body? Normally, 150,000 to 450,000 per microliter of blood. That's your normal platelet. Now, if it falls below 150,000, it's called low platelet thrombocytopenia. The danger zone is when the platelet level falls below 20,000 and risk of a spontaneous bleeding goes quite high. Now, do people have symptoms of thrombocytopenia? It depends how severe is thrombocytopenia. If thrombocytopenia is mild, you may not have any symptoms. Okay. But as it gets worse, moderate degree or severe degree, then some people are going to have signs like easy bruising, tiny red or purple dots on the skin called petechiae, sometimes spontaneous nose or gum bleeding, prolonged bleeding from simple cuts. In severe cases where platelet count is like close to 20,000 or less, people may end up having internal bleeding, which is a medical emergency. So the question is, what causes low platelets? Main causes of low platelets. And I'm going to discuss that. Number one is decreased production from bone marrow. The problem lies in the bone marrow, the factory for platelets. Platelets are made in the bone marrow. Some diseases like dengue fever, hepatitis, HIV, COVID, vitamin B12, folic acid deficiency, alcohol access, chemotherapy, radiation, and bone marrow disorder like aplastic anemia, leukemia. They can cause decreased production of platelets. And then you have a second in the list, where is increased destruction, immune related or consumption. So platelets are being produced normally, but in this case, it's being destroyed too fast. Number one cause is immune thrombocytopenic purpura. Body attacks its own platelets. The condition is called ITP, commonly seen in lupus. Certain medication like heparin, certain antibiotics, and anti-seizure medication, they can cause that. Severe infection, sepsis. Pregnancy-related conditions called HELLP syndrome, HELLP, HELLP syndrome. There's increased destruction of platelets. Number three is sequestration, where platelets are trapped. They get trapped in enlarged spleen. And the common causes? Number one is liver disease, cirrhosis, where spleen gets enlarged because of back pressure, portal hypertension. And when the spleen becomes enlarged, it increases the chance of platelet sequestration. In fact, it increases the chance of sequestration of all blood cell lines, including white blood cells, red blood cells, and platelets. Cirrhosis and liver disease is known to have pancytopenia, not just the thrombocytopenia, but it affects every cell lines, white blood cells, red blood cells, platelets. Portal hypertension, an enlarged spleen from lymphoma or other blood disorder, they would cause platelet sequestration as well. So how do we evaluate low platelet patient? We first of all we repeat complete blood count to make sure there is no lab error. Second is we do peripheral blood smear, and then we check the liver function test, check B12, folic acid, and some viral test if needed. And selected cases, bone marrow biopsy. The treatment option is cause based. What's causing it? You have to remove the cause first. And sometimes, in mild cases, we just need observation and treat infection, a deficiency. Now, if it is ITP, immune causes, then main treatment is prednisone or immunoglobulins. And they also have now newer immune modulating medicine. They are very effective. If it is deficiency related, like B12 and folic acid deficiency, then of course you have to fix that with supplement. In case there's a several there's a cases of severe bleeding, and patient need hospitalization and need platelet transfusion. If there's internal bleeding, then patient needs to go to emergency room and get admitted. When to seek urgent care? If your platelet count is less than 20,000, it should be looked into urgently. If there's uncontrolled bleeding, that should be looked into it urgently. If the blood in the urine and stool, that should be looked urgently. If you have severe headache, nausea, vomiting, that could be sign of internal bleeding as well, or any new neurological symptoms. So low platelets are not one disease. They are a sign of some deeper problem. So treatment depends entirely on why the platelets are low. And you need to fix that why. And many causes are reversible when they are identified early. Thank you for watching.